I think we'll make a start. Ooh. Sorry. I think we'll continue. I said this was the first conference, of course, and the first of everything is special when sometimes things don't go quite right. This reminds me of the birth of my first son, actually. It was very difficult. Anyway, everything was fine in the end. So I want to talk about myopia control, and I'm from the University of Auckland, and although we've had connections with Nepal for a very long time, as I say, this is my first visit. Is this, do I control? Thank you. Okay, so what I want to talk about is myopia control, and the aim of my talk really is to ask the question, can we improve perhaps I'll point at this one, if I can find a pointer, it's very bright, isn't it? Can we improve the efficacy of myopia control by combining different methods of reducing myopia progression? And before I start, I have to acknowledge or disclose some interests, some patents associated with contact lenses designed for controlling myopia. That doesn't mean that you don't have to believe anything I say, but you have to take what I say with a pinch of salt, because I have a potential interest in the outcome. So I just want to go over a summary of what I'm going to talk about. The first one is why control myopia? Why is it of any interest to anybody to control myopia? And what do we mean by that? Then I want to talk about some animal models of myopia, because we've learned a lot from animal models. Then I want to talk about some optical methods of myopia control. And then I want to talk about two studies, two relatively recent studies. One combining two optical methods to see whether we can improve the efficacy of myopia control, and that involves a multifocal orthokeratology. And a second study in which we combine atropine with optical defocus to see what happens, whether in fact that's likely to give us a better control, better myopia control. And then I'll say a few words in conclusion. So the question is, why control myopia? And this is a piece of evidence that was assembled by somebody called Flitcroft. And what it basically shows is the increasing risk of myopia, the increased risk of myopic maculopathy with increasing refractive error. So even the point about this slide is that any myopia is bad. Any myopia increases the risk of myopic maculopathy, which is basically sight-threatening. And the reason that it is associated with the increased risk goes up very rapidly with increasing refractive error is, of course, because the refractive error relates to the amount of axial elongation that's occurred in the eye. So up here, you can see this is a typical myopic eye, the larger one compared to a normal one. The anterior part of the eye is normal. The abnormal part is the abnormal extension of the posterior pole, with stretching of the choroid and retina particularly. So that's the origin of the myopic maculopathy in the end. And the more the eye is stretched, the more probable it is that you will develop myopic maculopathy. So trying to control myopia is one of the reasons for doing that is to prevent people from developing myopic maculopathy when they're older. Now, there are two. This is a kind of a diagram of myopia progression, typically what happens. So it's a plot of refractive error versus age in years of a typical child. And typically children start off at slightly hyperopic. And then for some unknown reason, we get myopia onset. And after that, and note that the children are actually hyperopic when the myopia starts to progress. And so we have an onset, and then a progressive worsening of the myopia until it levels off later in life, typically. This isn't the only sort of myopia, but this is the typical form. And almost all of this sort of myopia results from an abnormal elongation of the eye, as shown in the top right-hand corner. Now, if we wanted to control myopia properly, of course, what we'd really want to do is prevent the children from becoming myopic in the first place. But we don't know how to do that. And I'd suggest, actually, that problem and that issue is really a public health issue. It's not really to do with optometry. It can be informed by optometric knowledge, but the implementation of measures that might prevent children from becoming myopic in the first place is really a public health issue. And the other form of myopia control basically is preventing this extreme progression. Typically, this arrow that's just come up is the point at which you would see the child in your optometry practice or in a hospital or something, where they've just noticed that their vision is getting bad, and you would normally give them glasses. What we really want to do, of course, is give them something that prevents their myopia from progressing to higher levels. So maybe cuts the progression in half using some treatment. And that's really the topic of my talk, is what those treatments could be. And of course, when I say that we're going to prevent the change in refraction, what I'm really talking about is we're going to attempt to prevent the abnormal axial elongation of the eye. Okay, so now an awful lot of what we know about eye growth, we're trying to prevent the eye from growing abnormally long, so we want to know what actually controls the normal growth of the eye. And our understanding of that has come from animal models, and I just want to go through these experiments because it's really nice to talk about other people's research. It's really nice to talk about classical research, and these particular experiments, in my opinion, are really beautiful. So I'm just going to explain them. So we have a chick here, and they've got, let's say at day 1, we start at day 1, we put them in the laboratory, and we measure their refractive error of each eye, and we find that both eyes are emmetropic. The red one's going to be the experimental eye, the black one's going to be the control eye. And we put on the first day, we put on a -10 lens down there at the bottom on the experimental eye, and that moves the image plane to behind the retina. And we do it by using these sorts of lenses up here, like we've seen in the top right corner, in a chick. So there's a chick wearing a lens, and they wear them for the next 6 days. They go back in their cage, and we feed them and that sort of thing. And on day 6, we have a look at their refractive error in each eye. And what we find is that both eyes are emmetropic, but the eye that's the experimental eye is only emmetropic when we have the lens in place. So basically, when we take the lens away, down the second row, the animal is a -10 myope because their eye has grown abnormally long. And so we put the chicken back in its cage, and we wait for another 6 days to day 12, and it's not wearing a lens. And we go and measure the eyes on day 12, and they're both emmetropic. So they've recovered from their myopia. Now this is a remarkable sequence of events, and it demonstrates actually that the eye growth is controlled by visual experience, basically. So we can make the eyes too long or too short by exposing the retina to certain sorts of defocus. And we can summarize this process as an optically guided emmetropization process, because in fact what it does is it controls the eye to make in a normal eye to make sure that it doesn't become myopic or hyperopic. So as the eye grows, it grows to be emmetropic in the normal course of events. It's an emmetropization process which normally matches eye length to the power of the optical components. So if we fiddle with the power of the optical components by putting a lens in place, then that actually alters the eye growth. So hyperopic retinal defocus there on the top causes something I haven't talked about yet, which is thinning of the choroid, which you'll see is a relatively important issue first. Initial thinning of the choroid, which actually occurs in a few minutes after the exposure of the eye to this hyperopic defocus, and then over the next few days, abnormal eye elongation. And the opposite sign of defocus, myopic retinal defocus, in which the image plane is anterior to the retina, causes a thickening of the choroid in a few minutes, and then over the next few days, it inhibits eye elongation. And you can see that's quite useful.